Now it's my great pleasure to hand over to Professor Bruce Edmonds, who will run this panel. So over to you, Bruce.
Thank you. So today we have a panel of 3 experts talking about agent-based modeling and other related complex simulation techniques with respect to social and public health issues. Obviously, public health and complex simulation has been in the news, what with Neil Ferguson's famous lockdown model from Imperial College, as it has come to be known. So this is an area where the potential is starting to be very obvious, but we'd like to see some actually 3 examples and discussions about particular applications in this area. So we're starting with 3 short talks, 3 short introductions, and the first one of these is Professor Lawrence Moore, who is Director of the Social and Public Health Sciences Unit at the University of Glasgow. So I'm now going to turn over to him.
Thank you, Bruce, and thank you for the opportunity to speak today. Yes, I work in public health, where, as you say, there has been use of agent-based models has become quite well established. But that has largely been in the context, as we've seen very recently, as Bruce has said, in the context of COVID, and prior to that, principally agent-based models have been used in infectious disease modelling, different forms of contagion modelling. But particularly in the developed world, and also, as this slide shows, across the whole world, the greater proportion of morbidity and threats to life expectancy, healthy life, is through non-communicable disease. And so therefore, we were fortunate to receive funding from the UK Prevention Research Partnership, which is a consortium of all the research councils and a number of other major charities and the 4 devolved governments, to do more work into non-communicable diseases. So our particular interest, which I'll focus a little bit more in my presentation, is on the application of agent-based simulation to non-communicable diseases in population health. But of course, the work we're doing and it very much recognises that, as other speakers have said earlier today, when we take a complex systems approach, we need to recognise that there are many systems, systems of systems. And so, of course, the work, particularly around COVID, can't be done, particularly if we're looking at different ways of moving out of lockdown and living with COVID from this situation on, the whole idea of how we balance different aspects of social distancing and freeing up the economy a little bit more, requires both non-communicable factors as well as the traditional communicable disease factors to be taking place in those models. And indeed, when we work on obesity, mental health, health inequalities, certainly the communicable diseases, particularly COVID at the moment, needs to be taken into account as well. Public health generally focuses on, there's multiple definitions of public health, but a good definition that we like is that public health focuses on what we as a society do collectively to ensure the conditions in which people can be healthy. Often when we think of health, we just think of individuals who are sick and treated by doctors in the health system. But really, health is much more than that. And population health and public health research tries to understand who stays healthy, who gets sick, why, and what we can do. And of course, many of the factors that influence the health of the public are not within healthcare systems at all. And 2 of the most effective public health interventions that can be taken anywhere, taken in this country in Victorian times, were to improve sewage systems and improve the quality of the air. That's a continuing challenge, of course. And these are great examples of public health interventions which do not take place within the healthcare system itself. This diagram, many of you will have seen before, it may be new to some of you, But this recognises that whereas the traditional focus of much biomedical research and much of the healthcare system focuses on the individual, whether it's their physiological and genetic factors or their individual lifestyle factors, actually there are many, many other factors that shape our health, both individuals' health, but also the health of populations. And if we think about the life expectancy of someone born today in Norway compared to the life expectancy of someone born in for example, India, it's not so much those individual factors that are really important, it's actually the living and working conditions and the social conditions that are different between those settings that really determine major differences in health, both at individual and at population level. And thus there's a whole kind of system of different factors acting at different levels interdependently that we really need to understand population health. One of the major challenges in this country and in many other countries, and certainly globally, is the fact that an increasing proportion of substandard health is located in a small number of people. Health inequalities are continually widening in most societies globally. And this is a result of many factors acting interdependently at multiple levels in this kind of multi-layered complex system, which involves both health considerations, but also much wider social and economic considerations. If we think about the health of an individual born in the East End of Glasgow, their life expectancy is over 10 years less than someone born on the western side of Glasgow, where I'm fortunate to live. And that's because there are their neighbours, the resources they have access to, such as education, but also retail and commercial resources, just reinforce synergistically a whole range of factors that combine insult upon their health at different levels across the system. In a systems perspective, and particularly an agent-based modelling perspective, can really help us understand that complexity. Individuals live within a wide range of different kind of contexts, and that involves a number of different agents, a number of different relationships with those agents. Now, some of those agents are individual level, and they might be social networks, such as their friends and family. And for example, work we've done in the unit, led by Eric Silverman, has predicted the demand for social care and has recognised that the demand for formal social care provided by the government is massively mitigated if there are strong levels of informal social care, usually provided by family caregivers. And thus by modelling the kinship networks within families where there might be very dependent people, we can get a much richer understanding of the potential outcomes of policies to reduce social care. And indeed, Eric's work there could reproduce the overall patterns, but actually identified some really important and unexpected effects, for example, of reducing retirement age, which would potentially immediately be thought to reduce the demand on social care by keeping people working longer, but actually then reduce the availability of informal social care to more elderly people. So getting an understanding of the different kind of relationships we have at individual level, whether it's with our friends, family, whether it's with our colleagues that we work or study with. In the context of COVID, of course, it's just the people we happen to be close to on public transport or in hospitality areas. And the different kinds of relationships that might link us to those people, which might be friendship, or they might be influence, esteem, power, or the risk of infection. These are all the kinds of things we can study with agent-based models by looking at the different types of agent and different types of relationship. And these can be very variable across subpopulations. We must also think of agents at other levels, such as organizations and settings. And much of the work we do in the unit is doing place-based agent-based models, where we're looking at exposure to environmental bads or to green space, which is environmental good. What we do in health quite a lot is we focus on individual causal relationships using randomized trials and causal estimation of relationships. But these can really be only understood as part of a wider system, such as we saw in the obesity framework published 13 years ago. And that framework appealed to many of us because it understood the importance of looking at the wider system. But I still think in most public health research and a lot of the way in which policymakers deal with public health research, there tends to be an emphasis on the left side of this table, where there's a focus on trying to identify certain answers to simple linear relating to causal relationships, usually highly empirical, using quantitative measurements, often from, as I say, randomized trials or other similar experimental designs. And there's not enough in public health research or in kind of the policymakers' demand for public health research that deals with these more kind of complex phenomena. And I think we have to do more of this research, even though we might understand that will be unlikely to produce certain answers to specific questions, but might give us a much understanding and enable much more nuanced and informed decision makers by decisions to be made by many policymakers. Finally, what specifically can ABM help us with in public health research? I think it can give us a much better understanding of the complex interactive systemic production of poor health. It can really help us test out interventions in silico. It's really, really difficult, often impossible, and certainly massively expensive to test out all forms of intervention, particularly public population level interventions, by doing trials or natural experiments. And by doing so in silico, we can identify what might go wrong, what's the conditions, assumptions that need to be met for things to go in the way we hope they will. And I think one important thing I'd like to say is this may be in a data-rich environment where we can develop models that are quite predictive, but it can also be in relatively data-poor context where actually developing the model with stakeholders and getting a clear understanding of what's going on can really improve our theory and understanding without producing very precise and potentially certain predictions. And they also help us, I think agent-based models can also be really helpful in identifying where the key uncertainty is and where the real most promising leverage points might be for decision makers to improve health. And finally, I think the agent-based model is relatively unique in that it specifically and explicitly takes considerations both at population level and individual level together at the same time. ABM can help us think about both of these because its ability to deal with multi-level agents. And then finally, it's wonderful for me to have this opportunity to speak here because I'm really keen that we can attract people who understand social simulation and have experience of using it into the population health field, and also hopefully to influence evidence users, research funders and commissioners to support more simulation-based, particularly agent-based modelling approaches so that we have better complex systems-informed research to help us reduce uncertainty about really important questions rather than continuing to answer with certainty questions that are much less important in my view. Thank you.
Thank you, Laurence. And the next speaker is Natalie van der Waal, who is Associate Professor at Delft University of Technology in the Netherlands.
Thank you, Bruce. So hello, everybody. I would like to introduce my discussion points for this panel. And I'm on the wrong slide, just one
On the end, yes.
Yes. I don't know, I got to the end. There we go. They can be summarized as social simulations for improving evacuations. So let me introduce myself briefly. I'm Dr. Natalie van der Waal. I'm an associate professor at Delft University of Technology. I work in the section Systems Engineering and Simulation, where we design systems. We look at things like participatory workshops and participatory modeling. And of course, we do a lot of social simulations. I'm both a psychologist and a computer modeler. My research interests are group decision-making in evacuations, but my background is broader. Generally, I tend to look at technology that can monitor humans and can also coach and help humans to improve their health and safety. My discussion points for this panel are based on my past European projects. The last one was called Evacuation. And I was looking at testing emergency communication strategies, both with computer models and experiments in the real world. And in my other projects, Impact and Socio-economic, I looked at social factors in emergency management and prevention, and how we can use technology to improve evacuations. So you might be wondering why me in this panel, because it's about health and social policy. Well, I would like to contribute to this panel by looking at how my social simulations of evacuation behaviors can help policy and how they are related to the health domain. So I would like to discuss some of the potentials of agent-based modeling. So where can they be helpful for policy? And I think when we look at evacuation models or pedestrian models, you can also call them that, they're really related to health at the moment. If we look at COVID and we need to socially distance from each other, you can think of pedestrian models where you look at evacuation procedures and people might have to keep the distance, or there is one-way direction, or buildings are designed differently in their use now. So that is one of the areas where they relate. So what can my work do for policy? I have a couple of points. The first one is agent-based modeling can help us create more understanding of human behavior. Well, why do we need it? If you need to make evacuation procedures or new policies for lockdowns, you need to understand human behavior. So example questions you could look at, or in my case, in the evacuation domain, is do groups evacuate faster than individuals? Or does falling or helping behavior reduce evacuation time? You need to understand this if you want to set a certain number, like the building has to be evacuated within so many minutes, or if you need to understand if groups can be evacuated as fast as individuals. Another point is I want to make models more realistic because we need them. If you're gonna set a policy for an evacuation time or a procedure, then you need a realistic model for prediction of evacuation time, for example, or if people actually are gonna pick up the new rules. So what I do in my work is I add social factors to the model. And this is now a trend in evacuation modeling. Traditionally, it comes from engineering, where we treat humans like molecules or gases. But really, there is psychology going on. There's crowd behavior, and that's what I add to the models to make them more realistic. Also, with agent-based modeling and simulation, I can find recommendations for training and management of evacuation. So, for example, which evacuation scenario should be trained? In real life, a lot of times when we practice for evacuations, we do a drill and we call it, we dump the building, all exits are open. But this might not be the best case. You might need to practice a situation where there's maybe only one exit open or something is blocked. Or now when we think of social distancing, a lot of buildings have one-way direction and we need to distance each other from each other. So how can you practice that? Another thing I look at in my work is which verbal communications or which signs work best to guide people to the correct exits or the nearest exits. And that last point I want to make, just like Professor Lawrence Moore did, is we can test interventions before applying them in the real world. It will save a lot of time and money, and it's also easier to do. So I will talk about an example where I've tested the effects of emergency lights and communications before applying them in the real world. This is one of the models I've created in my past project. It's an evacuation model. And I've included these 7 social cultural factors in them. They came from workshops with stakeholders from different transport domains. We had a long list of what we could include, but these were the most feasible. After I validated my work with real world data, I did what we call sensitivity analysis. So I looked at each of these social or cultural effects. How do they affect the outcome of the model? So the evacuation time. And I found significant effect of up to reduction of 30% in evacuation time from the social contagion, which means the spread of information and emotions. I also found that the helping and falling behavior actually did not have a significant effect on evacuation time. So another thing which you can do with agent-based models is you can look at the emergent behavior. So behaviors you can't predict from the individual level. So for example, if one person falls and then stands up, this person will be slower towards the exit than if the person would have not fall, right? So at the group level, I found that falling or helping behavior or this social spread of information and emotions actually leads to a faster evacuation, which makes sense because maybe there's less congestion at the exits. It becomes more of a phased evacuation, for example. Other effects I found were that groups are faster than lone travelers, and that age actually had a small effect on the outcome. So these are just a couple of examples of how you can create more understanding of human behavior. Then the last point I want to make, or the last example, is about testing new interventions. So what I've done is I looked at the effectiveness of dynamic floor lights that direct people to exits. Here you see pictures of these dynamic LED strips that guide you to the exit that I've now tested in real life. But before I did that, I tested it in my virtual environment. And what I found is that this dynamic floor lights can actually guide people to the exits, but they're only beneficial in high density crowds. So if you have a public transport hub, like a train station, for example, you might only want to apply this if there's actually a lot of people in your area. If it's only a low density crowd, then maybe this is not so beneficial for you. So that shows you can also find recommendations. So summarizing my points, with agent-based modeling in my domain of safety, evacuations, but I think also in the health domain, you can find recommendations for evacuation training scenarios and procedures, how you can manage emergencies or prevent certain situations. You can look at emergency communications. And my second point is we can test the interventions before applying them in the real world to save money and time, but also to gain more understanding before applying them. Thank you.
Thank you, Natalie. And our third speaker is James Woodcock, who is a Principal Research Associate of the Centre for Diet and Activity Research at the University of Cambridge. James.
Hi. Thanks, Bruce. I'm just... thank you. Yeah, so I'm going to talk a little bit about the propensity to cycle tool.
Can you just expand
isn't an agent-based model, but hopefully brings in some of the issues that we're interested in the discussion.
Sorry, James.
Working, Bruce? Sorry.
Can you just expand it into
share.
view? That's great.
It's not in view at the moment. Sorry,
it is in view, but it's not. Yeah, okay? It's not in the. Yeah, that's great.
Okay. All right. I'm going to talk about the propensity to cycle tool. The propensity to cycle tool was developed by an academic team, myself and Robin Lovelace at the University of Leeds, Anna Goodman and Rachel Aldred at the University of Westminster, funded by the Department for Transport with additional research and policy funding. It's an open source code base in R. It's a free to use website, and it comes with data downloads for more technical users. People may have been aware of it in this field, but it's gone through a major update and improvements, including becoming a micro simulation model in the 2018 to 2019 period. And it's a cycle planning tool, and it's widely used by transport planners developing cycling and walking investment plans, and recently in the emergency active travel bids that funding that was being provided in response to the pandemic. So what's the point of the PCT? What's it trying to do? Well, there's a planning problem that we are trying to engage with. So where should cycling infrastructure be built? Where it's easy to build, where there's lots of current cyclists, or where there's lots of potential cyclists. And what we would argue is that the temptation, the tradition, the easier things to do are to go where it's easy, or where you see a lot of cyclists at the moment. But what you want to be able to think about is where this potential is, where the cyclists could be in the future. But of course, you don't observe that at the moment. So our approach in the PCT is to make the cycling potential using scenarios for areas down to quite small geographical areas and along routes for the whole of England and Wales. So it's quite a big data problem, this, as well as a simulation model. And it's a little bit more complicated than this, but essentially, in the main are scenarios and the hilliness, i.e. people are less likely to cycle longer trips and they're less likely to want to cycle a trip if it's hillier. And the scenarios are what we call hypothetical what-ifs. There's a range of scenarios, but these are hypothetical what-ifs, Go Dutch and e-bikes. And they're not predictive models, but they're saying if people in England had the same willingness to cycle as the Dutch do, what would be the levels of cycling and where would it be distributed, and what would be the impacts, the population impacts for that. We use census data on travel to work because that's the data set you can get at small area levels. We also do travel to school as well, because similar data are available. Unfortunately, for other trips, you can't get such data. And we have a model, which you see here, the fitted curves from the model and the observed data, looking at the relationship between trip distance and the route gradient and the propensity to cycle. And this is for our current baseline model of the level of cycling in cycle commuting in the country, which then we modify in different hypothetical scenarios. So why scenarios? Why do we use scenarios? Well, transport models, traditional transport models, there's a lot of models used in transport, but they don't deal that well with walking and cycling. There's different reasons for that we could talk about in the discussion. But in particular, a problem for cycling, which is a relatively rare mode in much of England and Wales. If you calibrate your model, particularly very much on the current behaviours and data, it's very hard to kind of use that then to predict a major step change, a major difference in that behaviour. You end up just predicting small incremental changes. And yet when we look at other countries, other places, or even some of the cities like Cambridge within England, you can see that you could have very, very much higher levels of cycling, not 1 or 2% increases. So we use these hypothetical scenarios. And in these, we say, well, what would cycling look like in England and Wales if people were as likely to cycle as those, for example, in the Netherlands, allowing for trip distance and hilliness? It's a bit flatter in the Netherlands than in much of England. And just to link it to the complex systems model, the agent-based discussion, they can also be used to investigate step changes and tipping points. And particularly if you think about maybe the kind of the cultural and social factors that might lead to cycling becoming a norm rather than a minority mode, agent-based models may be one way that people could try to study that. And I would argue that we need diversity in modelling methods. There isn't one right approach, and we think what we do here is really complementary to traditional transport models, but other kinds of modelling approaches are really valid and should be used as well. Just here to illustrate some slides from the propensity to cycle tool. This is obviously the national picture. I haven't got time to go and show you the individual routes and small areas, but we see here the level of cycling. The census 2011 highlighted is North Yorkshire with 5% mode share. You see that there's a different range of scenarios that one can choose from here. And then we see again at the big area level for the regions, the cycling to work under our Go Dutch scenario with in North Yorkshire would then be a 20% commute cycling mode share. So far high, and not something that would be able to be looked at in that way with the traditional transport model. as we're talking about health here, just to say a little bit on how we do health in the propensity to cycle tool. So, as I said, in a recent update, we've now got a sophisticated microsimulation model for estimating health and health economic impacts. This is based on the Department for Transport Appraisal guidance, but we've improved, we've gone beyond this in several ways, which I can talk about in the discussion or people ask me separately. And we calculate mortality reduction using individual age and gender, local authority mortality rates. So as has been said earlier, of course, there's big differences between local authorities, and changes in active travel, so increases in cycling but decreases in included hilliness in. So of course you're less likely to cycle in a hilly area, but you'll actually get more physical activity and more energy expenditure if you do so. So you get more health benefit if you are if you do decide to be active in a hillier area. We also calculate sickness absence, which is important for the health economics, using average earnings and appropriate relative risks relating that to levels of physical activity. So just coming to my last couple of slides now, the findings from the PCT. Well, I mean, there's massive cycling potential in England and in Wales, and this would have correspondingly a large carbon benefit and much bigger, very substantial health benefits, which put into monetary terms around 2 billion per year from commuting alone, and that's only about 20% of total trips. Currently, cycle commuting in England and Wales is highly demographically skewed by gender and age. Men are more likely to cycle, white people are more likely to cycle. The trips and the potential, what you see is that women and the non-white people tend to make more cyclable commuter trips in terms of distance and hilliness. And actually, if you look at high cycling countries, you do see that women tend to cycle more than men. Thank you for listening.
Thank you very much, James. Now I'm going to ask all the panelists to switch on their video and microphone, ready for the discussion. Laurence, Natalie?
Yeah, I couldn't start it. Yes.
Good. So there's been one question about validation. Maybe each of you could say a bit about the sort of balance between sort of modeling activities and the activity of just getting the data and getting it in the right format and all of that stuff, and the difficulties and maybe of that. Any comments?
I suppose if I kick off, and I think clearly this is very important. However, I think in a lot of the discussions I'm involved in, particularly with traditional kind of health research funders, I think its importance is perhaps overemphasized. I think clearly you do need some data. So, for example, in the model that Eric Silverman did that I briefly alluded to, I mean, he was able to build his model up sort of conceptually with input from people, you know, a range of stakeholders who kind of understood the problem in terms of social care provision and identified the importance of family members in providing a large part of social care through informal social care, and the importance therefore of considering that kind of family context. So in terms of validation, he was able to build his model, validate it against the kind of aggregate figures, but then use it to look at various and to kind of reproduce those figures, but then to use it to look at the potential response to different kind of policy change scenarios. And the one I briefly alluded to was a policy scenario being considered, and actually since enacted, is increasing retirement age. So that in a kind of a linear way of thinking, you might think if you can keep people working longer, then that should then reduce the burden on social care, just because people are sort of at post-working age for a shorter period of time. And in fact, his model showed that in doing that, you would actually reduce the numbers of people available. So 60 to 65-year-old women who might be available to look after their aging parents would then be having to work longer. And so actually the effect of increasing retirement age was a huge disbenefit to the public exchequer. So that element wasn't really validated, but the kind of like the overall sense checking of the model was done both by the sort of conceptual sense checking and then also some empirical validation of the aggregate results of the model as fit against current data. But just finally, I mean, we did recently have a workshop a couple of weeks ago with some of the people we're engaging with, and this area of getting hold of data that can be used to validate our models is clearly one of the biggest challenges, albeit my answer is trying to suggest that just because you can't validate the whole of the model against the perfect data set doesn't mean the model building exercise is fruitless. Far from it, because it helps us understand what's going on and what might change in relation to policy scenarios without having perfect data. If you've got the perfect data, you don't need the model.
Yeah, I can relate to
Natalie,
that.
yes.
Yeah, thanks. I can relate to that too, that it's very challenging to get the correct data. So in evacuation modeling, a lot of well, pedestrian modeling, you use video footage of pedestrians or tracker sensors, so you know their location, so you can calibrate the model or also validate your model against the data. But what I've done is I added social factors like people traveling in groups or people spreading information, and that's really hard to find. So
Yeah.
what I did is I just used a data set in which there were no social factors to see if I can predict that with my model. But then I would turn or switch off the social factors in my model to see what that adds. And then if that model with those social factors predicts the real world data better, then I assume, you see, it's better to have a more realistic model. But of course, I still don't have a perfect validation with the real world. So that's what I'm doing now in the coming years, performing experiments. So the current trend is using also things like virtual reality, and then looking at decision making or how people interact in groups. Yeah, but in the end, it's always going to be tough. And the last thing I wanted to point out is we also need people to have, to make data more available. So if do evacuation drills in their offices or campuses, or if emergency scenarios have happened. So for example, I looked at a lot of videos from YouTube, just publicly available videos, to see what people do actually in emergency situations, and I could actually find a lot of it from that. But I would need more data sets with a camera angle from the top, so I can actually see the walking patterns of people, and then create a culture where we can actually share. That would be really good.
Yes, I quite agree with that. James, do you have anything to add?
Yeah, I mean, a model is never going to be valid per se. I mean, it's always, when talking about validity, it's always kind of validity for a use in a context, and you've got to try and think, what are you trying to do with a model, and what kind of validity is appropriate for that? And if you need very, very precise short-term predictions, then you want something very different from a model than if you're trying to understand trends or trade-offs or something. So, you know, I think the questions about validity can sometimes kind of confuse these different kinds of things. I mean, we know that we can show that Hillian Earth and distance explain a lot of the variation between areas in terms of levels of cycling and to an extent between individuals, but we weren't trying to develop, certainly with that, a kind of model that captured all of those factors. We thought they were important, they explain a lot of variation, and they're relatively fixed. Well, some relationships, we do look at this differently in different scenarios, like between age or gender and cycling levels. They're not fixed. We see them work differently in different contexts. So if we just had a model that we can very, very calibrated on that to start with, which we do in one of our scenarios, then you will just reinforce those biases and those differences. When I think that they're not fixed, and I think that we are interested in what may change them.
Yeah. So I mean that those correspond to my thing. I'm always frustrated about the envelope of how much I can validate what data, and I'm always left with a partially validated model, you know, and you can get better, but getting all the way, I've never gone there, never succeeded yet. And the big frustration in getting hold of data, because even when you know there's some data out there, you often can't get hold of it.
Yes, but I think
yep.
because our field is still quite new, if you compare it to something like psychology, which is older, or other sciences, maybe you have to look at what you want to predict. If you want to predict as very specific evacuation time, would be nice if you can have a complete validation of your model. But if you just want to look at patterns, like in my social simulations, I want to look how frustrated travelers can become, and then if I could just see trends, it goes up or down, or very fast or very slow, then sometimes that's good enough. I don't need to have an exact number or a precise time, and then I don't need to have a precise validation of my whole model.
Yes, but there's two aspects to validation. One is sort of calibrating it so you get the right number out, but the other one is just sort of signals when you got it totally wrong, or there's some very subtle factor that will result in completely different output that you weren't aware of, and you do want enough check so that you know when you're on that sort of wrong track. Yes, Laurent.
Yes, I think that's right. I think there's different types of validation, aren't there? So one is to have the perfect data set, which can kind of validate everything you've got in your model in a number of different ways. And as I say, that rarely exists. I mean, with big data coming through and areas of application, that's increasingly likely. It provides greater opportunities, but it's rarely going to be there. And in a sense, when it is there, it kind of means you almost don't need the model. I think there's other types of validations. There's validating against, you know, theory or the understanding of your stakeholders, or actually a really important other way, which Bruce kind of alluded to there, is actually if you can have different groups developing different kind of models. I think thinking there's only one model that's going to be the correct model is not necessarily helpful. I think if there are different approaches being used, and then if you find that adding something in just produces something that's way different, then you need to kind of understand why that is, and either kind of make sure you correct your model to not have that there, or actually understand that, yes, this is something we really think is a bit different, and it's going to produce deviant findings for reasons that you can kind of explain and understand. So validating in different ways, and not purely through empirical validation against super rich data sets, I think is something we have to be thinking about all the time, particularly if we're developing our model to help our understanding and guide our decision making in the context of complexity, rather than using our model principally for predictive purposes. There's different reasons for doing modeling.
At the other end of the scale, I mean, in all of these models, there is some sort of behavioral rules put in there that you don't like cycling up hills, or you move towards friends in a particular way, or that you interact with people in your local geographical context. How do you know how to formulate that into a formal algorithm? Because there's usually some choice in how to do that, and sort of results from psychology rarely tell you exactly what to program. In fact, very far from it in my experience. So how do you go about making sure you got the right sort of behavioral rules? Yes, Natalie.
I can give two examples. One, which is quite easy, I've modeled the effect of a certain evacuation sign on people's route choice. So then I can look at studies. For example, there's a study in which they saw that maybe only 37% of people actually see a sign, but then when they see the sign, they follow the sign. So I can directly translate that in my model, that in a certain area, my agents can actually see the sign, and if they see it, then they follow it. So then I can base it on research. But I've also modeled the social identity theory in my models. Like if you help a person that's fallen down to stand up, then psychology tells us you're more likely to help a woman if you're a man, or if you're an older person, you're more likely to help a child, you know, if you're an adult. So then it becomes experience based on your experience. You know how to model like emotions into numbers, and then yeah, I do.
Yes,
Yeah.
I agree. I'd really like to go a little bit beyond just plausibility. I know I don't like going up hills, but how do you make that into the right rule? I know that I might help some people in some circles, not another. You can sort of write that from plausibility, but sometimes that's not enough. I don't know whether Laurence or James have any more comments on this issue.
I mean, just to say on that, I mean, yeah, I mean, the hilliness is really quite easy. I mean, you can observe a lot of trips. You can observe cycling in different areas. You can do, you know, regression analysis. You can derive relationships, and then similarly for distance, these kind of decay functions. I mean, these are relatively easy to convert into kind of quantitative. Much harder, and this is one of the reasons why we use these scenarios, are the kind of a lot of the social relationships that people are more likely to cycle because they see other people cycle. They see people who cycle who they feel look like them in some way. The image of cycling, whether it's represented as a kind of dangerous or a sporty behavior, or as in the Netherlands where people would do it in kind of more, you know, everyday clothes and so on, as well as the fact we know people are influenced by traffic levels and volume and things. You can have some of those kind of relationships, but trying to quantify, turn all of these things into quantitative rules is the psychological theories, even when there's what seems like a reasonably clear kind of psychological, sociological theory. When you try and think, well, what does that mean in terms of an algorithm? Well, you know, that's a big gap that I know many people are struggling with, and
yeah. Okay.
I think for my contributions to this, I mean, I'm in a unit where we do quite a lot of multidisciplinary public health research, particularly intervention research. So we have a lot of people in the unit and people from stakeholder organisations we work with who have a really good understanding either of the theory and the academic literature around a topic, or just kind of like the lived experience of dealing with it or managing it. And a lot of the work we do is around doing thorough kind of group model building and systems mapping to have everyone chip in their ideas of what should be included and what the rules might be. And I think, but I'd have to be honest, in the work we've taken forward so far in my unit where we've been developing agent-based models, we've tended to have to sort of just be very careful about how we build up the models incrementally, not do something too complex too quickly, and provide the scope and potential for building up the model once you've got a few key parameters built up and done some learning, both through your model runs, but also perhaps through uncertainty quantification and this kind of thing, and then sharing the results back with the stakeholders to kind of build up the theory and therefore enable that to incrementally then build up the model. So not going for something too complex or too certain too early, and building up the model sort of incrementally, I think is the most practical way ahead from what I've seen so far.
I think that's right. Maintaining sort of control and understanding of your model as it grows in complexity is quite a challenge. I mean, one way is trying to do it as modular as you can, but there are limitations to that when they're all interacting. Another way is sort of check one element at a time. But another one is just sort of trying to keep the sort of descriptive sensibility of it. If it relates to what you're trying to model in a straightforward way, it's a lot easier to tell if it's going off course. When if you get some sort of quite abstract psychological theory, it's very difficult to tell whether that's the right answer or not.
Yeah, but I still think it's always going to be difficult because psychological research, you test hypotheses. So you test
yes.
is it true or not? And when you make your computer model, there's so many assumptions. You don't want to know there is an effect. You want to know, is it 60%, 61%? And which person on the other person has an effect? And what if I add another person? So I've worked with like social psychologists, cultural psychologists to implement some of these things in my model. and I'm asking them questions, give me exact numbers, it's really hard for them to tell. So you're always going to need so many experiments to really validate your model. Like you said, it's always a partial validation because it's lifetimes of research to validate the exact theory, but still it can be done. Like Lauren said, I call that experience, because you look at the results of the model, you talk to the stakeholders, you look at the patterns that come out. So I think we create more hypotheses and experiments for the psychologists to look at. We're actually helping formalize psychology.
Yeah, I find that when I'm working with some social scientists, I get a similar sort of problem. They think in a very non-temporal way. They don't think about processes. They think about a hypothesis or a correlation and whether that supports it. They don't think of how processes might be developing over time. And if you actually get them involved in an agent-based model, it starts to change how they're actually thinking. And then some of the questions come to the fore. But that's a long educational process.
I think, there's a lot of people who have done a lot of work on how you can increase policy uptake of evidence. And I think one of the most promising strands of that is that you just need to maintain a dialogue and develop trusted relationships. And then it does time. And in a sense, building up an agent-based model is actually a way you can do that and to formally represent the expansion of the shared understanding of the problem at hand. And I think we're finding, not universally, of course, and it takes time, but we're finding those groups where we have a long-term relationship, they're kind of getting a bit fed up with asking simple questions that need really quick answers, and we give them the answers, and then they realize, well, actually, that's not really helpful. And then you start having, well, why isn't it helpful? And it's like, oh, because there's this and this and this is also going on, and you haven't captured that in this very conversation you've asked, addressed. So then that's exactly the conversation, and in a sense gives you the language to have that conversation over a period of build up the understanding and formalize it, and potentially have something in a few years' time that's going to be hugely valuable and potentially kind of quantifiable and really useful as a planning tool.
Yeah, the value of an iterative arrangement, a relationship with stakeholders over a long period of time, so you can start developing the project, the model, go back to them and again, is hugely valuable. It's quite sometimes difficult to fit into the sort of grant structure where you get a grant for 3 years and then a different grant for 3 years.
One thing we do a lot of work on is increasing the value of information analysis across a different range of models. And I think trying to understand what your model is sensitive to, and those are the areas that you need to focus on, because you start off, there's so many uncertainties, but they may not all matter. You've got to think, well, what's my problem? What's my question? And then let's try and understand which of these uncertainties which is my result sensitive to. And something may change, but it may not either affect your pattern of results or your decision, or what's the right decision do in a context. And if you can develop that iterative approach, then you can say, well, okay, that's the area we need to do more research in. That's where the psychologists, we would really like them to start now with it 60 or 61. In other cases, it doesn't matter if it's 95, or in terms of what the range of policy options that would be considered are.
Yeah, in papers, I would really like authors to write their assumptions in order of certitude. So starting with the assumptions and data where they're most certain, down through the ones where it's plausibility or expert opinion, down to pure guesses. So you could actually try and see that, but it's very important to manage that, I think. There's one last question maybe that came up in the question, and we might touch on. How do you think we can persuade organizations to be more free with their data, maybe under certain conditions to researchers? Are there any ways to do that? It's always safer for an organization not to release data. How can we go and persuade people to open up a bit more?
In the safety domain, I think it's quite easy and not easy. A lot of safety managers or safety practitioners would love to share their work and on procedures and guidelines and their data sets. But things like CCTV footage of emergencies that have happened, they yeah, they cannot always be made publicly available. So if it's like office drills or drills on campus, I think it's easy to persuade people so we can help each other. But yeah, other footage might be more difficult to share.
I don't know. I don't have an easy answer to that, apart from one is having emergency, because I think COVID has really helped us access quite a few data sets that we hadn't been able to access at all before, both public and private sector data sets. So I think the collaboration that has happened around COVID has been excellent. So hopefully there are lessons to be learnt. I mean, I don't know in terms of some of the different funding sources available from UKRI, where they're trying to increase the interaction of researchers with private sector organisations. I think it would be really helpful to build data streams and big data kind of understandings into that. And I know that there are obviously examples across the old research councils of attempts to have greater access to commercial sources of data that would be helpful. But it's a continual problem, and in work across the unit, both our simulation work, but also some of our natural experiment work we're doing, just getting hold of public data sets. Everyone wants it to happen, but getting it to happen is just really difficult.
Yeah, yeah. Maybe sort of encouraging people to release synthetic data sets that are very similar to the real data, but don't actually reference particular people or particular buildings, because you don't want your building to be known as the one where you don't want you'll die in a fire. No one's going to release their data if it says that. Do you have any, we seem to have lost James. Lawrence and Natalie, do you have any final comments of things you would like to say? You've only got a couple of minutes now.
I don't think so. I think
you've said everything.
Yeah, I think I'd just like to emphasise that agent-based models, I think, are such a useful tool to support research that's informed by a more kind of complex systems perspective. And I think that's really important, because so many of the big issues of today are issues where traditional methods like a randomized trial or causal analysis, this kind of thing, just won't cut it, won't produce evidence that translates across context. And we just really need to recognize that the simulation, whilst it's not going to give us a straight answer, a certain answer to all the questions, it really does enrich our understanding.
Yes.
Natalie, any final thing to say quickly?
Yeah, I agree with Lawrence that you're never going to get a straight answer in a way. So I think the first step is always to understand why was this model built. It always has a goal. And if you understand that, then you know the scope of the answer or the possibility of the answer. And I was thinking of James's model of cycling, and as I'm Dutch and I just lived in the UK, I just left the UK, came back to Netherlands. I think the environment is a big factor too, because even though it was hilly, I cycled to work, but I missed the bicycle lanes. So I think if you provide a nice environment to do it, it might become a habit, or people will pick it up. So that's something I want to say to James.
James, do you have any final comment, because we're going to close in a minute?
Yeah, I mean, I'd entirely agree on the infrastructure points. I mean, I would say in terms of data provision, the government makes sure it's written into contracts, particularly when working with private agencies for the provision of data with consultants and so on. I think that's really important, the availability of data. I'd also just say that for heterogeneity in models, the future is inherently uncertain, and there's not one right approach. We're going to need different approaches, and that's a form of validity to see, as I think has been said, to see if they say different things or why they say different things. And that's our understanding. To understand, that's what we really want, to improve our understanding. Why do they say different things, not just be black boxes?
Thank you very much to all our three speakers. I'll just pass back to Brian for the last sentence.
The last, I want to just echo that. Thank you, Bruce. Thank you, Natalie. Thank you, Lawrence, and thank you, James. Again, an excellent contribution, ranging discussion. It was actually me that dropped that question about the data, having had experience of having lots of data and wanting somebody to come and mine that data for me preferably free of charge, but ultimately do that. But so I want to say a big thank you to you. I want to say a big thank you to all of the attendees. We've averaged around about 60 attendees for each of the themes, each of the panels, which I think is excellent given the course of the day. So thank you, everybody. It will all be online in the next few days. People have kindly put their contact details in, so maybe people can contact each other bilaterally. And as I say, this is the start of a conversation, and I look forward to catching up with you all very soon. Have a nice rest of the evening, and we'll see you again. Thank you. Bye.
Thank you. Bye, everybody.